Good morning, Lake Providence Church family and friends. This is Dr. Linda Plummer Ward with another health ministry update. Thank you for joining us today. Well, we have some good news. Our metrics continue to improve as the number of new cases and the number of deaths decrease. We still have a high number of new cases per 100,000 residents and a concerning number of patients in the ICU. However, overall, the number of patients hospitalized has decreased significantly. We believe this is due at least in part to the number of us with natural and now acquired immunity. Remember, natural immunity occurs from surviving a COVID-19 infection and building up antibodies to the virus, SARS-CoV-2. Acquired immunity occurs when we are vaccinated and we make antibodies in response to the vaccine without ever having the COVID-19 disease. Now, vaccinations are available for those age 70 and above, for healthcare providers, long-term care facility workers and residents, first responders, adults who cannot live alone, outpatient healthcare workers with direct exposure to patients, and mortuary services. In addition, in Davidson County, teachers and staff will be vaccinated as of February 20th. This will be by appointment as usual. As the number of people with immunity increases, SARS-CoV-2 will not have as many opportunities to infect us. The people around us will be immune and our bodies will have a quicker and stronger response to the virus if we're exposed. SARS-CoV-2, remember, requires humans to survive. It has to infect us to reproduce and replicate. It can't live by itself. When everyone within a few feet of a person with the virus has antibodies or are immune, the virus can't infect those individuals, and it has to work harder to reach somebody close enough to infect. It cannot thrive, and it cannot continue to form new variants unless it's replicating and reproducing. I'm excited about that. By the way, happy Valentine's Day weekend to all of you. Now, this is also Heart Month because we're trying to raise awareness about heart disease, especially in women. This is a #1 killer in this country. We know that family history, age, and lifestyle factors such as diet, exercise, those things contribute to heart disease. A poor diet and sedentary lifestyle lead to obesity and diabetes. Some of these factors we can control, and doing so lowers the risk for heart disease. About half of Americans have at least one of the key risk factors. That includes hypertension, diabetes, high cholesterol, and smoking. Heart disease is one of the risk factors that may cause a poor prognosis with COVID-19. Other patients that may not do well with COVID-19 that are at higher risk are those who are immunocompromised or those who have diabetes, lung disease, or obesity, and that's in addition to heart disease. Now, COVID-19 can indirectly affect the heart by affecting the lungs and decreasing the oxygen level in the blood. The heart is responsible for pumping oxygen in the blood from our head to our feet. If there's not enough oxygen, the heart tries to work harder to make sure that there is enough oxygen pumped around. This can strain the heart muscle and cause congestive heart failure. COVID-19 can also cause blood clots, which may affect the lungs, the heart, and the brain, causing pulmonary emboli or blood clots in the lung, heart attacks, and strokes. In addition, COVID-19 is an inflammatory disease. It can cause direct inflammation to the heart muscle. We call that myocarditis. That can then lead to heart failure as well. So for these reasons, we want to pay close attention to our heart health. It's important to control those things that we can: our diet, exercise, sleep habits, and cigarette smoking. It's also important to seek medical care, especially now during the pandemic. If you develop shortness of breath or chest pain or other symptoms that are concerning to you, don't ignore those symptoms that could be serious because you're concerned about exposure to COVID-19. Again, thank you so much for listening. And let me remind you, remember to watch our Black History Month presentation, Living History Museum, Hidden Figures of African American History, on YouTube today. Have a blessed day and have a blessed week. Stay safe, stay healthy, and stay prayed up.